Eye on Health is live tonight. We're talking about flu season because it's already here. You know, we've been talking about it here as well. We know that some of you have some questions too when it comes to other things like RSV and COVID-19. So we are joined now by Dr. Deepika Kumaresan. Thank you so much for being with us.
Thank you for having me.
She's a primary care physician for adults at Baylor Scott White, just so you know. The first thing I want to ask you is about trends we're seeing right now. The flu season, like we said, already here. But what are you seeing specifically in your office as it relates to flu, COVID, and RSV?
So right now, the flu season is fully on. And we do see patients with COVID, with flu, and we also see some RSV, and usually RSVs are infection is the one which is very severe. And yes, this is the right time to get your flu shots.
Yes, do it now.
Yes.
Right? Okay, so in terms of families protecting themselves, especially if they have children, if two adults in the house, whatever it may be, what do you think is the number one thing we should be doing besides the flu shot?
Okay, so as your primary care provider, the most important thing is make sure that you're washing your hands thoroughly and cleaning the places where you're touching. And also, you need to cover your coughs and sneezes. Stay away from sick people as much as you can. And also, if you feel like you're having symptoms of flu or COVID or RSV, just stay home. That's our responsibility.
I'm glad you brought that up because I think there can be some overlapping when it comes to symptoms with those three. Can you just briefly tell everyone at home the differences between those three and what we should be looking for?
Yes, so your RSV is the one which is very severe. Like you're going to have really bad shortness of breath, and and usually it affects the elderly, and also very young patients, and the children. And your COVID is, as you know, mostly it can range from mild to very severe symptoms, and you can have also loss of taste and smell. That's something which is peculiar to COVID. And your flu can range from fever, headaches, really bad fatigue, body aches and pains. So that's your flu. So again, I can't reiterate more. Flu shot.
Flu shot. Okay, get it now. I'm glad you mentioned kids. If I'm a first-time parent and I notice something may be off with my kid's respiratory system, what should I be doing?
Okay, so first thing is that you need to assess the situation. If the symptoms are mild, you can handle them at home. You can get in contact with your healthcare provider and get some over-the-counter medications, and you can take care of them at home. But when symptoms get really serious, like shortness of breath, and they can't keep their fluids down, and really bad high fever which you cannot seem to have control on, that's when you need to get medical attention right away.
That's when I need to
Don't
go to the
wait.
ER. Okay.
Yes.
Okay. Before I let you go, any new treatments about RSV, flu, or COVID this year? I know we know the shot, right? The flu shot, handy dandy, but anything new that you guys are working on or that you see?
Well, for RSV, we do have shots for older patients again, and we do have preventative antibodies for children. Okay, that's there, and you do have your antivirals for your flu and COVID. And that's you as usual, but you want to talk to your healthcare provider to see which one would suit you better.
Sure.
But the most important thing is that you take care of your health, your immune system. That's another topic by itself.
Yeah.
We'll talk again about that.
Okay. One thing I want to ask about the antibodies for children. Is there an age restriction for that at all?
Right now, I'm an adult physician.
Right.
So for older patients, we do recommend them get their RSV shots.
Okay.
But antibodies, not every patient is going to be eligible for that. So that's like a one-on-one conversation for that particular case and with their healthcare provider.
Any questions you have, ask your PCP, ask your kid's pediatrician, just ask the question. Thank you so much.
Thank you.